Hi, I'm Bree Parsons, student at St. Elizabeth School of Nursing.
Hi, I'm Cheyenne. I am 26 years old and I consent to have Bree perform a physical assessment on me, and I authorize Bree to video this assessment and upload the video and audio of the assessment to the learning management system for course faculty evaluation.
Thank you.
You're welcome.
All right, this begins the head to toe assessment. Knock, knock.
Hello.
Hi, good morning. I'm Bree. I'm going to be your nurse today. How are you this morning?
I'm doing well.
Great. Can I just have you verify your name? I know they don't have a wristband for you.
My name's Cheyenne.
Okay. I just came in to do a head to toe assessment, and it's going to take us anywhere from about 30 to 60 minutes. The goal is to get you discharged from the hospital, so we're again going to do a full head to toe assessment. I'll be asking numerous questions about your health history and have you do a handful of things for me as well. Okay. I am going to wash my hands before we get started, but before I do that, do you have any questions for me?
No, not at this time.
Okay, so I'm going to go wash my hands. All right, so I have noticed just coming in to talk to you that your appearance appears to be within normal limits. I don't notice anything abnormal about this patient here that sticks out. So her appearance is appropriate, and so far her responses to me have been appropriate as well. Can you go ahead and tell me, do you have any allergies that you're aware of?
I'm allergic to peppers.
To peppers, okay. And what is your occupation? What do you do for work?
I work as a medical assistant.
Okay. And do you have anything today that is sticking out, like pain?
I've been experiencing a headache.
A headache, and how long has that been going on?
This is day 4.
Day 4 of your headache, okay.
It's more mild today though.
Okay. Also, while asking these questions, again, my patient is still responding appropriately. And I have noticed that my patient has a nice straight posture. So just by looking at her sitting here, her posture doesn't appear to have any deformities. However, I will assess that later when I have you get up to do some movements for me.
Okay.
Outside of work, do you do any extracurricular activities, hobbies that you have?
I've recently started working out again, and I like to go to the pool.
Okay. And I know that when I first came in, I went ahead and asked you to verify your name. Can I go ahead and have you re-verify your name for me?
My name is Cheyenne.
Okay, and can you tell me what month we're in?
We're in April.
Okay, and can you tell me where you are?
In the hospital.
Great. So my patient is alert. She is oriented ×3 to person, place, and time. And again, her mental state, she's responding appropriately so far, and again, no worries thus far. So before we kind of get moving throughout the assessment, I want to go ahead and get a full set of vitals on you. And what that's going to entail is I'm going to do your blood pressure and all of that fun stuff. And then I'm also going to check all of your pulse sites, okay?
Okay.
So the first thing I'm going to do, I'm going to go ahead and get your temperature. Okay. And her temperature was 97.2, so that's within normal limits. And I'm going to go ahead and get a pulse. right. So your respirations were at 14, and that's just you watching your breathing. And I don't announce that just because people can kind of change up their breathing. Your pulse was also within normal limits. Your radial pulse, it was 80 beats per minute. And I only did the pulse for 30 seconds because it was normal, so I just went ahead and multiplied it. However, if that pulse wasn't normal, I would have done it for a full minute. And then I'm going to go ahead and get your oxygen. Okay, her oxygen is at 98%, so her oxygen is also within those normal limits. Next, I'm going to do a 2-step blood pressure. It's just to get a baseline and an accurate reading of your blood pressure reading. My patient here is going to stay in her gown, but typically we would like our patients to have their bare arm. So it was at 150, so I'm going to pump it up to 180. Gonna listen with my diaphragm. My patient's blood pressure is absolutely beautiful. It's 120/80, so that is also within normal limits. Okay, so the next thing that I'm going to do is I'm just going to palpate her head. And again, while I've been talking to her, just looking at her face and her appearance, her head so far appears to be symmetrical without lesions or any bumps. So I'm going to go ahead and palpate just to be sure that there's not any wounds, lesions, masses that are hidden here. And then I'm also checking for the texture and distribution throughout her hair. One, just making sure that it's even and that the texture is the same throughout. And I did not feel any lesions while palpating. Did you have any pain while I was doing that?
No.
No? And have you ever had any concussions, any brain surgeries, any neurological history that I should know about?
I had 2 concussions when I was younger.
Okay. So even though that was a while ago, I'm still going to go ahead and note that in the chart, just for various reasons. It's still good to know, even if it's been a while. So head was free of lesions, masses, no tenderness. I will say anytime throughout the assessment, if something does feel painful, please just let me know and we can mark that down in your chart.
Okay.
So the next thing that I want to look at is I'm going to go ahead and do those pulses just again because I'm going to have you get up here in a little bit, and I just want to kind of get a normal actual baseline of like your pulses and how they feel while you're at rest. So I already did your radial here, and I'm going to go ahead and just do your ulnar. And what I'm checking here is different pulse sites, just one at a time, and then we could even do it together. And why I do that is to make sure that each pulse site is getting a normal and a good blood flow. And by feeling your pulse sites, that can kind of give me a little deeper information on if blood's getting, to your feet or up to your brain through your carotid artery. So her radial and ulnar Both have been normal and present. And then I'm also going to feel her carotid. And I won't do these at the same time just because it can, there is a risk of cutting off your circulation. And then while I'm up there, I'm going to go ahead and just take a listen. Good. And I was just checking for any bruits, which is just a turbulence of blood flow. So no bruits, sounded great. And then the next one, again, my patient has on her gown, so we're going to allow her to leave it on. So we're going to check her brachial. Good. I'll check this one. Okay, and those are even. And then I would also do a femoral, and then a posterior tibial, and then I'd also do her dorsal pedis here. Good. Sometimes those can be tricky to find, so the fact that I can feel yours pretty easily was pretty good. So again, that just kind of gives me a better understanding and reading of your pulses while you're sitting at rest. And I didn't think I started the video. Anyway, sorry. So the next thing I'm going to do is I'm going to move down to your eyes. And I'm going to use my little pen light here for a backup. And what I'm going to first have you do is I'm just going to have you take a look at this wall here and just kind of stare at the wall. And while I'm in this position, I've given her a direction on what to do. So this allows me to do multiple things. One, I can kind of have her stare off into the distance and check her ocular movements to see if there's any extraocular movements that shouldn't be occurring. And I also get to see her head, and there are no abnormal head movements. So then I'm gonna go ahead and take a look at her pupils. And they're about 7 to 8 millimeters. So I'm gonna go ahead and have you take off your glasses. And do you see the eye doctor regularly?
Yes.
And do you also wear contacts?
No.
Okay. And any visual disturbances at all? Any visual problems other than the obvious?
I have something convergence. I can't remember what it's called, but it makes my eye try to go that way when I strain too long.
Okay. So that's also good to know, and we will document that in her chart, especially because during the assessment, it may be noticeable. So it's good to have that prior information from my patient here. So what I'm going to have you do is I'm just going to shine my light in each eye. And I'm going to do that a couple times. One, I'm going to look for... Here, I'm going to look for your pupils, make sure that they're round and symmetrical, which they are. They're beautiful. Just from doing this, I can see that your sclera is a beautiful white. The sclera doesn't have any redness or inflammation or anything that stands out that shouldn't be there. So again, just kind of stare back here at the wall. Okay. So her pupils not only react to light individually, but they also have the consensual response. And then I'm just going to have you follow my pen here. Okay, so her pupils, they do accommodate. We are doing beautiful, good. And then what I'm going to just do here is I'm going to bring my hand forward, and you just say when you can see it.
When.
Okay. And again.
When.
Okay. So then typically what we would do is we would have the ophthalmologist come in, and he would kind of do we would come in and we would do a Snellen chart. However, for your specific assessment, we won't do that. But the Snellen chart is just finding out your visual acuity, which is what they do when you go and get your eye exams. So we would do both eyes, and then we would have you cover an eye. Okay, so can I have you take those back off?
Oh.
Because now I'm going to have you pull down your eyelids, and I'm just going to look at your conjunctiva. Good. They are a beautiful pinkish red color, moist, no inflammation, no pain. And then I'm noticing that her lacrimal glands look absolutely beautiful, no inflammation, no redness. And then I'm just going to palpate your sinuses. Do you have any sinus problems?
Sometimes I get allergies and they get stuffy.
Okay, so like I mentioned, just let me know any pain, tenderness.
Nope.
Okay, and while I was palpating there, I noticed that her skin, the texture of her skin, not only in her scalp and her head, but on her face, was normal and is free of wounds. You can go ahead and put those on. Okay, so the next thing that we're going to do is I'm going to go ahead and go down to your nose. And just from looking at it, it looks symmetrical. Do you have any smelling problems where you feel like you can't smell at all? Okay, so what I'm going to have you do is a patency test, and I'm going to have you just... And I also noticed that her septum is not deviated. It's also beautiful as well. So we did the patency. Septum looks beautiful. And then I already palpated your sinuses here. And then your ears, again, just looking to make sure that they look normal, no redness, lesions, or wounds. And do you have any troubles hearing?
No.
Beautiful. And do you clean your ears out at home?
Yes, I use Q-tips.
Okay, so this is going to be in your discharge paperwork. We are not going to recommend Q-tips just because that can actually further push the earwax further into your ear, and it can cause damage to your ear. So I'm just going to take my little flashlight here, and I'm just going to take a peek in your ear just to see if there's any redness, inflammation, any critters that shouldn't be there, which I don't see. And then I'm going to palpate your auricles. Any tenderness at all?
No.
Okay, and I don't see any or feel any masses. I'm going to whisper something in each of your ear, and then you're just going to whisper back what you think you hear.
Taco Tuesday. Let's go.
All right. So the whisper test is nice to do on a patient just to make sure that you can still hear those lower pitched sounds. And she did great in both of her ears. And so the next thing I'm going to look at is my patient's mouth. And just looking at her mouth, I can see that it's symmetrical on the left and the right side, free of lesions. The color is pinkish red as it should be. No wounds, not overly dry, so her mouth is beautiful. She said she forgot to brush her teeth, so...
Well, I brushed it this morning before I came in.
Oh, before you came into the hospital.
Yes.
Okay, and that's okay. So I'm going to just take a visual peek at her teeth and gums, and what I'm checking for there, just go, just making sure that you don't have any tooth decay or that the gums are swollen, inflamed. I think I just made that word up. Inflamed. And that there's not any lesions or wounds, and your teeth looked amazing. Any tooth pain at all?
No.
Okay. So the next thing I'm gonna have you do is I'm gonna have you go and I'm just looking at your hard and soft palate and your buccal mucosa. And I wanted to just make sure you do have your tonsils, correct?
Yes.
Okay, I saw those, so those looked nice. Her hard and soft palate were that nice pink, reddish, moist color. Buccal mucosa also are within normal limits. Teeth are within normal limits. So far, again, my patient is beautiful. So then, I already palpated and listened to your carotid arteries, but I am just going to look at your trachea. So I'm just gonna have you again look there. And what I'm looking for here is that there's not like a irregular bulge that's popping out. It looks symmetrical. I'm gonna go ahead and palpate your lymph nodes and tell me if there's any pain. No pain. Okay, so upon palpation, I did not notice any lumps or masses. So as far as her neck, she looks good. Do you have any trouble swallowing?
No.
Okay, and no other issues other than those allergies maybe that kind of go and bug your throat every now and then?
I do have thyroid issues, but it's controlled right now.
Okay, and so later in the assessment, I am going to do a more in-depth, but with that thyroid, do you have any weight gain or loss, or is that kind of under control as well?
I gained the weight, but it won't go anywhere else. I can't lose it.
Okay, so I'm just gonna note that since she was able to tell me that her thyroid has issues, that she has gained some weight and that she hasn't been able to lose it. So we will want to document that just so we could have a chance to assess it further. So the next thing I'm going to do is I'm going to go ahead and listen to your heart and lungs. And before I do that, because this can kind of get patients winded a little bit, do you have any shortness of breath while at rest or while doing physical activity?
I notice it while doing physical activity, but I think that's because I'm a little hefty. And I've also noticed it more when I have to take a deep breath.
Okay, so again, I like to just ask my patient that because when I listen, it could cause her to be winded. So I know that. So I'm going to listen to your heart, and you don't have to take a deep breath. Okay. And I'm going to first listen with my diaphragm. And here I'm just listening to the aorta, or the aortic, and the pulmonic. Beautiful. And Erb's point. And then tricuspid. Mitral. Now my patient is bigger chested, so it can cause some difficulties when listening, especially to the heart and lungs. However, we just kind of work around that and get as close as we can. Now I'm just going to go back and listen with my bell because it allows me to hear a different tone. So again, aortic, pulmonic, Erb's, tricuspid, and mitral. Good. Now I'm going to go back through your lungs, and I'm just going to have you take a deep breath. Okay, so then I would go down here just to kind of listen to that lower part of that second lobe, because in the left lung there's only 2 lobes. But again, because she is bigger chested, it's a little bit hard. So I would kind of just move it under her chest here to try to get as close as I could. And then also on the other side as well. So then I'm going to go back and listen to those same landmarks with my bell. And then I'm just gonna kind of have you, I'm gonna listen here on the lateral side of your lungs. Okay. And then I'm just gonna listen to the back here. Listening here with my diaphragm. Okay. And I'm just gonna go back through with my bell. Okay. Lungs and heart sounded great. I'm going to go ahead and get an apical pulse, which will be for a full minute. And that's just that bottom left part of your heart. And because my patient is wearing a sweater and shorts, I've been able to see that she doesn't really have anything that stands out as far as tattoos or piercings. But I do want to go ahead and just verify that there's not any, because we're not going to have my patient get into a gown like we typically would. So do you have any tattoos or piercings that I need to chart?
I have 6 tattoos.
Okay, so I will get the location of those tattoos and we will get those documented. I'm just gonna take a listen to the apical pulse here. Sabia. Sounds amazing. I got you at 84. Let me do it from the front. So what I'm going to have you do is I'm just going to have you say 99, and I'm feeling the vibrations of your lungs. Just say 99.
99.
Okay. And then that also allows me to look at the expansion of her lungs, which while I was also listening, and then during that tactile from Fremitus, I was also able to again listen for the vibrations and then the expansion of her lungs, which everything again was within normal limits. So the next thing that I'm going to have you do is, can I just take a peek at your fingers? And what I'm checking for here is any discoloration under the nails, and it's within normal limits. I don't notice any yellowness or any other discoloration. And then what I'm going to do is check for capillary refill, just making sure that it is 2 seconds or less, which it is. Then I'm going to have you do this here, and I'm just checking for clubbing. Good. And then I'm going to go ahead and just have you roll your sleeve up here, and I'm going to check her skin turgor, which was less than a second. She had great skin turgor. All of that's just a skin assessment, just to make sure that internally everything is going correctly and that fluids and oxygen's kind of making its way through the body appropriately. Okay. Any pain so far?
No.
None? Okay. So the next thing that I'm going to have you do is I'll go ahead and have you uncross. And then what I'm going to have you do is squeeze my hands here. Good. And then I'm gonna have you hold your hands here and don't let me push. Okay, and then push against me. Good. And push against me. And don't let me push. Okay. Since my patient, we are trying to discharge her from the hospital, I just want to make sure that she has regained her strength after the diagnosis of having a really cool friend that could really take that away. So we just want to make sure that her strength is, again, within normal limits before we discharge her. So her upper body strength was great. I had the 2 tests, and then her lower body was also within normal limits as well. So now what I'm going to have you do is I'm going to have you hold your hands out and close your eyes. And then with my handy dandy pen here, I'm going to draw a letter or a number in one of your hands, and you just tell me what you think that you're, what I'm drawing.
C?
Yep.
T?
Yes. All right, now we're going to do a sharp dull test. This is going to be sharp and this dull. Okay. And you just keep your eyes shut and you tell me sharp or dull when you feel me touch.
Okay. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull.
Okay. So
questionable there at the end.
I do want to do another assessment here after that, but I do want to take note that my patient, when doing that test, I did notice that her legs are fairly cold. Do you typically run cold?
Yes.
Okay. I'm also going to make note that my
So
patient
sorry.
is drinking
My throat was dry.
an iced coffee, and that could also be why she's cold, but I'm still going to make note of it just because we always want to be sure. So I'm going to go ahead and have you open up your hands, and what I'm going to do is I'm going to place an object in your hand and you tell me what you think that it is. Okay.
The pull socks.
Correct. Okay. So again, that's just testing to make sure that your brain messages are getting to your brain and your brain can kind of comprehend what's going on. So the next thing that I'm going to have you do, and before you stand up, we'll go ahead and just have you make sure that your joints are freely movable and that they have their full range of motion. And while you're doing this, please let me know if you have any pain while doing it, and then do you notice that you do have joint pain at all?
No.
Okay, so again, just let me know if you have any pain throughout the assessment. So go ahead and just show me that you can move your, and then go ahead and kind of move your hands here. Okay, and then while you're at it, go ahead and bring one hand. Okay, and then again, just show me at your shoulders that they can kind of move appropriately as well. Okay, and then we're gonna go down here and just kind of, good, and then go ahead and stand up for me. And here, I'm gonna continue to kind of bend at the hips. And this also allows me to assess your gait, which I just want to make sure that she's not like overly wobbly. She has a great gait. So then go ahead and bend each of your knees here. And then just show me that you can move your wrists and your ankles. Okay, and any pain there at all?
No.
And then before I let my patient sit back down, I'm just going to check her spine for any deformities, palpate for any deformities. Have you ever been diagnosed with scoliosis, kyphosis, any of that, lordosis?
No.
Okay, and any pain at all while I'm palpating?
No.
Okay, so no spine deformities. Go ahead and have a seat. Okay, and then I'm just gonna do a Babinski test on the bottom of your foot here. My patient had a negative Babinski. She did not have any reaction. My patient did not have any reaction, so she had a negative Babinski on both of her feet. So, assessing the lower body again, because we've mainly focused on the upper top of her body. I am not noticing any masses or lesions, any lumps or bumps. She does look symmetrical. Do you have any concerns up to this point?
No.
Okay. And then what I want to do is I just want to have you get up one more time.
Okay.
And then please let me know if while you're getting up specifically, if you were dizzy or anything of that nature. And then I'm just going to have you close your eyes. And what I'm doing here is I'm going to hold out my hands so that I can just make sure that my patient's not falling. And what I do is this is a Romberg test. Good. Go ahead and have a seat. So my patient seems within normal limits. I would be comfortable with telling the doctor that I believe that she is ready to go. Any questions for me?
No.
Okay. And the doctor did want to just give some additional education and handouts for you. And again, these will both be in your discharge packet. Okay. But is there any breast cancer that runs in your family?
Yes.
Okay. So we just want to make sure that we get you into the routine of doing a breast self-exam. Okay. And what you're doing is you'll kind of heavily palpate just that area to make sure that there's not any lumps or bumps that you're feeling. Okay. And you're going to do that on both of those breasts. So we're almost done with the assessment here. I just have to do an abdominal assessment here. And I know that you had some lower back pain, so I kind of tried to wait until the end here to do this. Alright, so I'm just going to have my patient lift up her sweater here. And as she's doing that, I'm going to ask if you've had any pregnancies.
I've had 2.
Okay. So that could tell me that if she has any stretch marks or striae, that would be normal for her. And again, with like any other parts of her body, I'm looking for symmetry, bruises, which I didn't see a single bruise on my patient's body, and I don't see one here. So I'm just inspecting her abdomen. Do you have normal bowel movements?
Yes.
Okay, and when was your last one?
This morning.
This morning. And do you feel like you have a pretty good nutritional intake of foods?
Yes.
Okay. And do you ever have any issues with going to the restroom?
No.
Okay. So I want to look at her abdomen before I do any sorts of palpations, because that can activate your bowel sounds. So now what I'm going to do is I'm going to listen to each quadrant, and I'm going to just make sure that bowel sounds are present in each of her quadrants. And if it's not present, I would have to listen to that quadrant for a full 5 minutes before I could say that they were absent. Starting with the right lower quadrant. And then I'm just going to switch it over to the bell. Okay, So the diaphragm would have been suffice. However, I just like to listen for both because you never know what you could hear when you switch that over to the bell. So the next thing that I'm going to do is I'm going to do a palpation in each of your quadrants. I'm going to do a light palpation, a more of a medium palpation, and then a deep palpation. And what I'm going to ask my patient to do is let me know if she feels any pain or tenderness at all. And especially once I release that palpation, let me know if there's any, what we would call rebound tenderness. So a light palpation. And a palpation in the right upper quadrant. Any pain? Nope. Okay, and in the left upper quadrant. And the left lower. And a medium pressure. Okay, and then one more deep. Okay, and any pain at all there? Okay, so I heard bowel sounds in all 4 of her quadrants. Her abdomen has a normal appearance, normal color. I do see the striae. However, I did ask my patient, and she has had 2 pregnancies, so this is normal for her. No pain upon palpation, no rebound tenderness. So if you'd like, go ahead and I'll have you sit back up. Okay, and then like I said, that breast self-exam will be in your discharge paperwork. That's especially important just because it does run in your family, and as women we like to catch it before it gets further along. But at this time, do you have any questions for me?
No, I do not.
Okay. Well, thank you so much for your time. I will put together your paperwork and then you will be good to go, okay?
Okay, thank
Thank
you.
you so much.